In the NHS currently, resource is very scarce. The commissioning side, we're 40% less staff than we were, but there isn't any less work. And the clinicians and the doctors, the GPs, they're seeing more patients now than ever before. It's up to 60 patients a day for GPs. As we knock on the door of 2015, where everything is web-based, online, IT and IT solutions have moved on, anything that assists clinicians and patients to utilise something different, the way we can't keep carrying on the way things have done before. It's got to be done differently, and the telehealth gives us telehealth assistive technology, anything like that. It gives us an extra resource that we didn't have before that we can utilise, as long as it's utilised correctly and obviously safety-wise. The whole system demonstrator was evidence, and it's the biggest evidence base that we have so far on telehealth. It was looked at on technology that was slightly older than we have now, and the doctors and the GPs are still looking at that evidence base as the stable that it is. What we have to do is we have to explain to them that that was some time ago, things have moved on. Patients tell us that telehealth is a really good thing to do. So the challenge mainly is to get over the thought that telehealth is simply an IT thing, that it's just a computer solution. It's so much more than that. And when you link it into the care pathways, it's a strategic enabler that will allow patients to have control and understand their health condition and help the doctors to manage it and the nurses to manage it, as opposed to it just being a, you do this, yes doctor, we'll do this.
Well, starting off, it was part actually with the practice-based commissioning, and we were looking really as a local area to commission the help and resources that we needed. But as time's gone on, then I become a lot more interested in a whole range of different kinds of telehealth, and that ranges from an avatar that we've recently commissioned help with from Keele University, which is helping children with asthma understand their conditions more, and it's all very focused on what that patient's age group's perspectives are and their needs are, to Flow Telehealth, which is more about mobile phone texting and the interactivity that you can set up between patient and clinician, and then also trying to set up video consultations in a safe way that includes all the information governance for patients' confidentiality and security. I think the main challenge is getting organisations to work together. So at the moment, with our West Midlands Academic Health Science Network funded project, we've got locally the Acute Trust to work with the Community Trust, Mental Health Trust and 3 CCGs, and now we're bringing in the 2 City Council and County Councils as well. And that's quite difficult because everyone's got different computer systems, and they've also got different targets, and you've also got to be showing that it's efficient, effective, productive and cost effective. But the other main challenge is really getting people to embrace innovation as part of their everyday delivery, and that's with keen and not so keen practitioners, as well as practices and units within the hospital and so on. On the whole, because I'm a busy GP in a deprived area, if it can be devolved to the nursing team, then that's what I find the most easiest, and I think that most GPs do that. So we've got practice nurses that lead on particular areas like diabetes, hypertension, respiratory, and have tended to work with the nurses and healthcare assistants over specific protocols like COPD, asthma, smoking cessation. And that way we make sure that they've got time booked out to sign the patients up and look at regular reviews over the server and sort of then contact the patient remotely. And that's worked out very well in our practice. I'm a clinical lead at the moment for the rollout of where we've used Flow Telehealth across the country, and we're just looking at the results now really. And the first 3,000 patients that we've looked at, for instance, with hypertension, one of the very popular protocols was whether or not we'd help people who'd appeared to have high blood pressure in our practice, but we weren't quite sure whether or not they really had hypertension. And NICE guidance says that you can use home blood pressure monitoring or ABPM machines if you are going to diagnose them with hypertension. And that particular one, we found about 40% of the patients across England, the practices that have used it, and we're talking about thousands of patients, had not got hypertension. So that was quite easy then for the practice nurse just to text them or phone them, tell them they've not got hypertension and please drop in your machine. And in that way we saved 40% of consultations as an example. So that was great. And also with COPD in my practice we've been showing how we've managed to trigger rescue medication at just the right time, which has really prevented patients deteriorating and obviously then avoiding, hopefully, an admission to hospital. Well, our local hospital's got a vision for over the next 10 years, and they are aiming for 15% of their care being delivered remotely. So I would have thought that was a really good sort of percentage and challenge, and instead of saying over 10 years, sort of bring it forward to over 2 or 3 years. But it'd be good to see if we could do that safely.